This video is for instructional purposes only and is not medical advice. Patients need to consult their physician or other healthcare provider to determine proper product selection. This video does not replace the use of the operator's manuals. There are 1.8 million new pressure ulcer cases each year, with 70% of those people being age 70 or older. Those most prone are people with spinal cord injuries, are quadriplegic, or are elderly with hip fractures. 24% of skilled nursing residents develop pressure ulcers at some time, and that number increases to 60% for people with hip fractures. Overall treatment cost has been estimated at $1.3 billion. And as you might expect, more than 17,000 lawsuits linked to pressure ulcers are filed annually. Pressure ulcers occur when blood pressure is severely inhibited or prevented from reaching the dermis. The capillaries close and the skin begins to break down. As the skin dies, a pressure ulcer is created. Areas most prone are the weight-bearing bony prominence points like the heel, sacrum, spine, elbows, shoulders, and head. A lot of different components contribute to the increased possibility of a pressure ulcer occurring. Those factors include the patient's physical condition, including their age and weight, skin characteristics, patient immobility and incontinence, and their mental condition and whether they suffer from sensory impairment. Pressure ulcers can also result from the skin being constantly moist or contaminated from perspiration, urine, or fecal matter. Even the simple act of moving the patient in the bed can cause pressure ulcers. One way is by shear. Shear is caused by gravity. When a person slides down or is dragged back up in a bed, gravity pulls on the skin and tissue. This can pull away the skin and tissue from the skeletal structure and cause a pressure ulcer. Another way is by friction. For instance, when the skin is irritated when moved across the bed surface. The subsequent breakdown can lead to a pressure ulcer. And it doesn't take long for a pressure ulcer to form. They can begin to manifest themselves in as little as 1 to 2 hours after blood flow is cut off. Treatment is expensive. Some estimates put the cost of treating a pressure ulcer at over $40,000. Some put it a lot higher. And available industry data shows that these ulcers can sometimes take as much as 2 to 3 years to completely heal. This is an important consideration for hospitals because as of October 2008, Medicare will no longer pay for pressure ulcers that develop during a hospital stay. This is because Medicare now considers pressure ulcers as preventable conditions. The challenge for long-term care has been evident since the revised FTAG 314 guidelines were published in November of 2004. The definition of what is an avoidable or unavoidable pressure ulcer is broad. Generally speaking, the regulation stipulates that based on a comprehensive assessment of the resident, the facility must ensure that a resident who enters the facility without pressure ulcers does not develop pressure ulcers unless that resident's clinical condition demonstrates that such a wound was unavoidable. The formula for therapeutic support payment is expected to be similar to national averages. That is 30% Medicare, 30% private insurance, 35% personal pay. It is estimated that at least 10% of all beds in acute care, nursing, and long-term care facilities include some type of prevention or treatment support surface, and that number is on the rise. According to CMS, the requirements for a Group 1 foam mattress are specific. Use of a Group 1 product may be covered for a patient under a documented comprehensive plan who is completely immobile or has limited mobility and/or any stage pressure ulcer on the trunk or pelvis, along with one of the following conditions: impaired nutritional status, fecal or urinary incontinence, altered sensory perception, or compromised circulatory status. Use of a Group 2 product may be covered if the patient meets certain criteria. They have multiple stage 2 pressure ulcers on the trunk or pelvis, and they have been on a comprehensive ulcer treatment program for at least the past month, during which time they have used a Group 1 support surface, and during that time, the ulcers have not improved or have gotten worse. It may also be covered if the patient has large or multiple stage 3 or stage 4 pressure ulcers on the trunk or pelvis. It may also be covered if the patient has had a recent myocutaneous flap or skin graft for a pressure ulcer on the trunk or pelvis within the last 60 days, and the patient has been on a Group 2 or 3 support surface immediately prior to a recent discharge from a hospital or nursing facility within the last 30 days. In this growing market, providers have the opportunity to diversify their business and broaden their revenue base. Care bundling has been shown to be effective to reduce pressure ulcer incidence. It involves first assessing pressure ulcer risk upon admission, and then diligent and ongoing risk and skin assessments focus on adequate nutrition, hydration and skin care, use of pressure redistribution surfaces, and turning the patient every 2 hours. Research has also shown that a pressure-relieving surface is more effective than a standard mattress in preventing pressure ulcers and is more effective in treating pressure ulcers. If you're a provider who is new to TSS, Group 1 is a good place to start with inexpensive and routinely purchased foam mattresses. Group 1 products are termed inexpensive and routinely purchased. Invacare's Ulcers Therapeutic foam redistribution mattresses are designed for Group 1 prevention and the first line of treatment. The covers are antimicrobial and moisture resistant to help prevent shear and friction. Seams are manufactured for infection control. Underneath, the entire mattress is covered with a fire sock and complies with federal fire regulations 16 CFR 1632 and 1633. And under that, the unique patented layered foam designs distribute weight as uniformly as possible to take some of the weight from the patient's more delicate weight-bearing areas. The top layers are constructed with softer materials on top for envelopment and firmer materials on the bottom for support and to prevent the patient from bottoming out. The foam is cut across the top to provide more surface area for patient support and relief. This configuration, often called a fortress cut, also works to reduce heat and moisture by promoting airflow. Solace mattresses provide better pressure relief than an innerspring mattress and are available in 3 series: the Prevention series for low-risk patients, the Therapy series for mid to high-risk patients, and the Resolution series for high-risk patients and for the treatment of existing stage 1 pressure ulcers. The Solace Prevention models, beginning with the Prevention SPS 1080, are cost-effective designs for the low-risk patient. Their dual-layer design equalizes interface pressure. They are also zoned to reduce pressure in sensitive head and heel areas to provide increased patient comfort. The Prevention SPS 2080 series adds built-in side supports for stability and durability, and the Prevention SPS 3080 features a specially designed visco foam heel section to cradle this sensitive area. For medium to high-risk patients, consider the Therapy series. The Therapy series, beginning with the Therapy STS 1080, have 3 layers of die-cut foam and provides more support and weight distribution. The Therapy STS 2080 adds built-in side supports and a visco heel section for more protection. And the Therapy STS 3080 includes a 1-inch visco top to cradle and envelop the entire body in foam. For high-risk patients, the Resolution SRS 1080 is the best Invacare foam mattress. It is constructed of 2 layers of the highest density foam with side supports and the added feature of a 12-degree heel slope to alleviate pressure. For those situations where a foam mattress is not the solution, a gel overlay is sometimes the appropriate support surface. Invacare gel overlays have individual gel cells that support the body and prevent gel migration like bladder-type overlays. Alternating pressure pads are another option. The Solace line can be the first step forward in therapeutic support for a provider who is new to the category or looking for a way to diversify. Providers familiar with wheelchairs and cushions have a similar opportunity to sell support surface mattresses. Additionally, according to industry estimates, a long-term care facility purchasing long-term care beds like those sold by Invacare has an opportunity for foam therapeutic support on most of those bed surfaces. Invacare provides guidance for new providers considering the category, but it is up to the physician and other healthcare providers to select the proper product. To expand your TSS offering from prevention into treatment, there is the Microair line of dynamic pressure relieving mattresses. They are Group 2 products. Generally, Group 2 products are paid by Medicare on a capped rental basis for 13 months. Microair mattresses come in both compressor and blower configurations. Each has its advantages. Compressors are quiet, energy efficient, and less expensive because they automatically turn off when the patient is in the proper pressure relief range. But compressors do take longer to inflate on initial setup. Depending on its size, a compressor can take anywhere from 10 to 40 minutes to inflate. Blowers, on the other hand, inflate quickly. They can usually inflate a mattress in 1 or 2 minutes. They output large volumes of air, so true air loss is possible. Blowers run constantly, but Invacare blowers are some of the quietest on the market. The control panels have been designed with clear descriptive icons so that the unit is both easy to understand and to operate. Just set the patient's weight using these large up and down arrows. Internal electronics monitor and maintain appropriate pressure. The panels have controls for setting different pressure cycles. Many competitors only offer one treatment time. And except for the MA50 series of mattresses, which have manual Fowler, all Microair models have wireless automatic Fowler booster. No longer does a caretaker have to remember to push the Fowler boost button on the display. If the head of the bed rises above the compressor at the foot, sensors will open the solenoid valves and 25% more air will be added to the mattress to prevent bottoming out. All models have low pressure and power failure alarms and a fail-safe panel lockout control. Control settings are stored in non-volatile memory, so they do not have to be reset should the power be interrupted. They will reboot once power is restored. And in the event of a power outage, with the compressor models, the mattresses remain inflated when solenoid valves close to prevent air from escaping. Covers are specially designed to prevent shear and friction. They are breathable, washable, and antimicrobial with infection-controlled seams. They comply with 16 CFR 1632 and 1633 fire regulations with a unique sewn-in fire sock that is readily visible inside the mattress and included in the top sheet as well. Most competitors offer fire protection as an option if they offer it at all. Clearly identified CPR releases allow caregivers to quickly deflate the mattress should it become necessary. All mattress replacement models feature a 2-inch foam cushion as additional prevention from bottoming out. For storage, just roll up the mattress along with the power unit, secure it with the hold downs, and use the carrying handles for easy transportation. Some Microair mattresses use programmable alternating pressure as a source of treatment. Alternating pressure works by first inflating and then deflating internal air bladders in a continuing sequence to gently massage the capillaries to increase blood flow and relieve pressure on the ulcer. The economical way to get alternating pressure is with the Microair 50. It's a mattress overlay and secures to the mattress with elastic straps. The Microair 51 is an 8-inch high mattress replacement system. All 50 series models feature manual Fowler, 4 alternating pressure cycles, and constant pressure monitoring. Wound care therapy is enhanced with the Microair 55 with the introduction of Invacare's on-demand modified low air loss feature. Modified low air loss is a system that releases air through a manifold around the mattress. This circulating air helps to maintain a more temperate environment, which in turn helps lower the temperature of the skin and helps to eliminate perspiration. The cover is vapor permeable and fluid resistant. All Series 50 models feature a 10-liter per minute compressor, which can take about 30 minutes to inflate. If startup time is an issue, then consider the Microair 60 series and above. The Microair 60 series are more enveloping mattresses and feature more powerful 50-liter per minute compressors that inflate a mattress in about 10 minutes. Standard in the Microair line, beginning with the 60 series, is the inclusion of wireless Fowler technology. This is an innovation unsurpassed at this price point. The Microair 65 offers the same features as the Model 60, but adds the on-demand modified low air loss feature. The Microair 80 series is the answer for fast setup with a powerful and quick inflating 1,275 liter per minute blower unit, automatic Fowler, and true low air loss technology. To achieve true air loss, air passes through microscopic holes in the bladders. This arrangement allows air to reach the mattress cover for superior moisture management. The Microair 80 features a pulse mode to achieve a wave-like motion of therapy, while on the Microair 85, the pulse feature is replaced with the alternating pressure feature. The Microair 90 series is the best choice in a dynamic pressure-relieving mattress. The Microair 90Z is powered by a 50-liter per minute compressor, has automatic Fowler, alternating pressure, on-demand modified low air loss, and features lateral rotation, up to 30 degrees of turning motion. It is the leading-edge design for lateral rotation therapeutic support. Lateral rotation has many benefits. It improves pulmonary function in heart patients. It helps prevent pneumonia by preventing fluids from settling in the lungs. And it improves urinary function. The 90 series features Invacare's unique Z-cell design innovation. It works by inflating or deflating targeted bladders to angle the patient without any abrupt movement. The Z-cell allows for both gentle and subtle patient movement and pressure relief treatment. So the patient is more comfortable and the caregiver doesn't have to physically move the patient. This can be an important consideration. Time, duration, and angle of turn can be preset from the control panel to assist with the caregiving responsibilities. And the unique automatic recentering capability means that the patient is gently repositioned back to the middle of the bed after a turn. The Microair 90 series have side bolsters that protect the patient and are compatible with standard bed rails. And they feature a special 4-way stretch urethane cover that is vapor permeable and fluid resistant. The Microair 95Z is a blower model with automatic Fowler, alternating pressure, true air loss, and can provide up to 45 degrees of turn. It achieves this with the addition of additional bladders at the base of the mattress. This is an important feature for patients with respiratory ailments. And exclusive to this model is the ability to customize all of the angles, time, and duration for the most effective treatment. Invacare's Microair mattresses are the most efficient Group 2 dynamic support surfaces on the market today. They evolved from a design philosophy that believes in combining comfort and technology to achieve clinical efficacy. Simple setup and maintenance make both the caregivers' and providers' jobs a little easier with a product that delivers relief and promotes an environment for healing. Maintaining an exceptional reputation in the marketplace is a key to success, no matter what type of business you're in. Reliable products such as the Solace and Microair lines offer you that security in power outage safety, simplicity in setup, use, and maintenance. With so many therapeutic support products available from many suppliers in this fragmented market, you can save time by choosing from Invacare's selection of popular services that meet your specific needs. With a one-stop shopping approach and a comprehensive line of products, foam and powered surfaces, Invacare offers a solution to meet your need and price range. They are a great value in comparison to the many TSS offerings. They are made in the USA and contain the features, the quality, and the durability that make them standouts in the field of therapeutic support surfaces. Invacare. Impossible stops here.